I think Kellogg is important to us and we to them. We have vulnerable children, but we also have a caring community that will, given the information, probably try to do something about it. And I think what we can show them, given that we're in the Rust Belt, so to speak, is the need for communities and large organizations like Kellogg to come together. And certainly Kellogg has offered us something. I mean, $1 million for them was a very large grant. What we were trying to do was to find data on very young children about their dental needs and about how they would respond to this kind of practice. We had thought we could probably attend to about 4,200 children. And in fact, over the 3 years, we got 7,200 visits in. Once we put them together, will give us a little bit more information about children in rural areas and in urban areas. And although we can't really generalize much because it's just these two sites, we at least have a comparison base that can begin to suggest possibilities for other sorts of research or public health interventions. We worked with WIC because, one, they were available and they were agreeable. And also, it seems a natural segue from nutritional foods to managing oral hygiene.
There are registered dietitians on staff at all WICs who determine if the child is at high nutrition risk, and then they can put them on a balanced diet, a food program that helps that child to grow.
Nurses and dietitians are excellent educators. Nurses do a good deal of health education. Dietitians do a good deal of nutritional education. And in this particular study, the possibility of the two disciplines coming together was even more likely, but it's a very natural marriage, you might think, between oral hygiene and nutrition, and then again between nursing and dietitians. The varnishing process involves clearing the teeth of any debris and then swabbing them with this particular application with a just a simple little swab. What you do is quickly wipe the teeth and just quickly swab again, and that's it. The biggest issue probably for smallest children is getting them to sit still. Older children can just sit on their mom's or dad's laps, open their mouths and zip, 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 and we're done. And we usually show the children how it's done on little puppet models that have prominent teeth, so that they can see it and that they can even practice it. Until we did this, the dietetic students had not been trained in oral assessment or in the application of the varnish. So it benefited the dietetic students quite a bit. It also benefited the nursing students because the pediatric nurse practitioner students must do this as part of their practice preparation, and it allowed these students to have that practice in a more profound way than they had before because we had so many more children to be able to varnish. And I think the students understood in a way they probably would not otherwise have the really profound need for oral health. In our first visit only, we had about 1,900 urban children. About 360 of them had discolored teeth already, or cavities, or already silver posts put in for replacement of teeth that are broken or lost. Those are kids that have vulnerabilities then to poor eating habits, to speech problems, to eating problems, and we don't think of that. And the other thing we have learned is that when children have poor oral health, they usually have poor physical health. So it's a signpost, if nothing else, that these children need other kinds of care. It certainly brought out the need for oral health and varnishing and assessments, particularly of very small, vulnerable children. And vulnerable, I mean those of low income. It also, I think, showed in a very strong way that these moms were very much aware of the need for oral health for their children, but they also had very few resources in the community. There are very few pediatric dentists, there are very few dentists who would accept Medicaid patients, and it also shows that with cooperation and a certain vigilance as well as training, this simple procedure can work and be applied in large volume quickly by experienced people.